Issues now, and the World Antibiotic Awareness Week ends this Sunday. It's about raising global awareness about the misuse of medication. So what are the risks? Anna-Marie Blackmore from the Pharmacodynamics Antimicrobials Unit joins me now. A very good afternoon to you, Anne-Marie. So raising awareness about the misuse of medicines, how widespread is this?
Well, antibiotics are certainly a very hot topic, and that's the reason why the World Health Organization is driving this. It's actually a global initiative to drive awareness around it. If we look at antibiotics at the moment, it's estimated about 700,000 people are dying every year from untreatable infections. And if left unchecked, by the year 2050, as many as 10 million people are estimated to be then dying from untreatable infections. And this is something that we can avoid just by using antibiotics responsibly and correctly.
We speak about using antibiotics responsibly and effectively, and a lot of the time we focus on patients who sometimes become addicted to some of this medication. But I'm wondering if health professionals themselves are prudent in prescribing antibiotics.
Well, the difficult thing with antibiotics is that about 80% of antibiotics are used outside of hospitals, so it's predominantly in primary health care, and the bulk of this is prescribed for acute respiratory tract infections. That's things like sinusitis or bronchitis, but it's difficult to know 100% whether the infection is caused by a virus or a bacteria. And about 60% of the time it's actually a virus, so then it's incorrect to prescribe an antibiotic. An antibiotic can only kill a bacteria.
Sounds like a fair enough or easy enough explanation. Why then are they given out to people who may need other forms of treatment?
Well, the problem is that a bacterial and a viral infection have very similar clinical symptoms. So the only way to really know for sure would be to send a sample off to the lab. But this takes time and it can be very expensive. So a doctor often they use their clinical judgment to make that decision. And I also think that the public plays an important role here, because there's this expectation when you go to your doctor to be prescribed a medication and not to be told, go home and deal with your symptoms until you feel better, or wait 2 or 3 days before we prescribe the medication. And I think it's important for everybody to take up their role in trying to protect our antibiotics and use them wisely.
Antibiotics, no doubt, a very important invention or discovery, if you can call it that in medical terms. But you spoke about how expensive things like sending samples for testing is, for example. You look at the majority of South Africans, a lot of them are poor. Not everyone can afford to get on the best antibiotics. So how do we make them more accessible?
Well, a lot of antibiotics now have got generics available as well, and the moment that you get generics of a molecule, it becomes a lot more affordable to the greater public. So antibiotics can relatively be used by most people, but I think what is a very important message is that they should only be used if they've been prescribed to you by a medical doctor.
In terms of managing the spread and misuse of antibiotics, I know when you go into some of the drug-ridden areas, you hear about how some of them are taken and mixed with other dangerous substances to produce whatever drug is required. Is there enough work, do you think, that the industry is doing to sort of tackle that sort of problem?
I can't really comment on that. I'm not aware that antibiotics are used as much in terms of addictive medicines, but they are a prescription medicine, and so they are controlled by a pharmacist. You can only get them with a script.
What should we all be doing this week then to mark what is an important medical week?
I think what's important is for everybody to understand the threat of a post-antibiotic era, which is a very real threat to not only our generation but the future generations. And I think for everybody to take the responsibility on themselves, and you also to look at infection prevention, because a lot of infections, if you can prevent them, you don't even need to use the antibiotics. And these are quite simple things like vaccinating, following good hand hygiene, cough etiquette, etc.
Vaccinating, what's better for the body, a vaccine or the antibiotic?
With vaccines, about half of the vaccines that we have on the expanded program of immunization in South Africa are for bacterial infections, and roughly the other half is against viral infections.
Anne-Marie Blackmore, thank you so much for your time this afternoon.